In this video, I want to talk about different levels of care when it comes to addiction treatment. And we're going to start with the highest level of care and work our way down to the lowest level of care. So the highest level of care, most would say treatment or detox, but actually, let's just go ahead and say the hospital or the emergency room. If it is an emergency situation, don't try to call a detox center. If there's been an overdose, you need to call 911. Go straight to the hospital. Now, after the hospital, or if the hospital isn't needed, you would be looking at detox. Detox is normally 5 to 7 days and is there to help someone transition through the withdrawal period. They typically give comfort medications to make this process a little easier before they go into a treatment setting. Now we're moving into residential treatment after detox, or some like to just say RES for short. This normally lasts for around 30 days and keeps someone in somewhat of a lockdown environment. They normally don't have access to things like their electronics, the outside world really, their transportation, and they're normally at a facility that's all on one campus so that they can keep them all right there. We tend to be a little bit squirrely or somewhat of a cat on a tin roof in that first month or 2 months of recovery. So this is very nice to have to just help hold us accountable and keep us clean. After treatment and a little more stabilization has taken place, we may be looking into what's called a partial hospitalization program, or PHP for short. This will last around 25 to 30 days, and it's Monday through Friday groups with clinicians. A lot of PHPs still have some sort of medication management, whether it be through a psychiatrist or a nurse practitioner, maybe a physician's assistant, but it's still help managing medications, still clinical help for 5 to 6 hours a day, Monday through Friday, to help get you back into your normal lifestyle. After PHP, you may be looking into an intensive outpatient program, or IOP for short. I've seen these last for 4 weeks. Most that I've seen go for 8 weeks, where you're still receiving that clinical help. Instead of going 5 to 6 hours a day like in PHP, you may be only going for 3 hours a day. 3 hours a day, 3 days a week. So you're stepping down that clinical care and you're stepping up real world experiences, getting that job again or getting back into school, whatever that may look like. And then after IOP, I've seen people step into OP, which is outpatient, which may just be one group per week and one individual session with a counselor per week, or some just step into individual therapy. And whether they go once a week to individual therapy or twice a week or once every other week, a lot of people like to stay connected and plugged in to where they have someone to touch base with. Now, I've seen a lot of people in their journeys skip steps along the way. Some may skip PHP and go straight from treatment to IOP. Some may skip PHP and IOP and just do some therapy. Some may just do a 30-day treatment and that's it. But in my recommendation, I love the full continuum of care. I think it gives us the best chances and it gives us the most amount of time with some stability and some accountability to get our ducks in a row. And I just think that our odds of long-term sobriety are much greater if we can do that full continuum of care. I love the thought of starting out with very high structure and low real-world experiences. And as our high structure in the clinical and medical is going down, real world is stepping up. So as we're taking things off of our plate here, clinically, medically, emotionally, we're stacking up our real world, our jobs, our schools, our relationships, and it should be a smooth transition.